Dr. Benjamin, when we start talking about health disparities, let's first define what are we talking about.
Well, you know, it's the differences in clinical outcomes that you see between one ethnic group and another ethnic group from a medical perspective. So we're talking about the differences in the rate in which people die, in which they get disease, in which they may have access to certain kinds of services.
How serious a problem is this?
It's a very serious problem. And the real problem and tragedy of this is it's preventable. We've worked very, very hard to make sure that women have access to mammography for breast cancer, to rule out breast cancer. And we have lots of studies that have shown that even if white women and African American women both have equal access to the test itself, black women still die at an extraordinarily high rate compared to white women. That's a disparity. And it's preventable because we know that there are reasons that those African American women show up late to getting their screen, or that they get a cancer that is, if we had caught it much earlier, we could have treated them much earlier.
Why do they show up late?
Well, a range of things. First of all, let's talk about the big one, not having an insurance card. So if you don't have the Get Into the System card, you know, all kinds of bad things happen to you. You can't get to a doctor. You have to encourage someone to see you. Even if you get screened and find out that you have a cancer, then because you don't have insurance, someone may not want to see you as quickly to give you the therapy that you need. And so there's a range of structural things that we put in our system simply because people don't have insurance cards that cause a real problem. But having a card is not enough. We need to have programs that, first of all, help identify people early who may be at risk. That's a big issue, particularly with older women. You know, there are many of our grandparents who believe that having a diagnosis of cancer means that you're going to die. They don't realize that we've made huge advances in cancer therapy. So we have to go out and we have to explain to those women that they can be treated. And we have to convince them that simply having cancer doesn't mean it's a death sentence. Second thing we have to do, of course, is make sure that people have access to providers in their community. And those communities and providers are culturally sensitive. Every one of the 10 leading causes of death, we have health disparities. We have more people of color who disproportionately either die or have a prevalence of that disease than the majority population. So if you think about cardiovascular disease and cancer and diabetes and HIV/AIDS and injury, these are all leading causes of death. And clearly people of color die disproportionately more than the majority population.
And what does that do to the black community?
Well, it helps decimate the population. It means that it's much more difficult for people to go to work. It has huge economic problems in the community. It creates economic disparities. You know that there's a huge percentage of the population that becomes bankrupt because of healthcare costs. And so you have a population in which is already disproportionately affected by these diseases. They don't necessarily have the funding to take care of themselves from a healthcare perspective. And then when they do get sick, they disproportionately end up having to lose everything that they own. That's a real problem. That is not what, you know, the America that I really want to live in. That's not the way America ought to be. One of the things that I discovered in my early days working in public health was when you went in those communities and you told people what their numbers were, they were shocked and they were mobilized to action. Many of our poor communities in particular, they know about their substance abuse problems, they know about their AIDS problems, but they don't necessarily know about their cardiovascular disease problem. They don't know about their problem with diabetes. And they don't know how those problems all come together. And that's one of the things we have to do if we're going to have an effective society. At the end of the day, if you're seeing someone walk down the street and they fall over, we are willing to spend millions and millions of dollars to take care of that person. Wouldn't it have been cheaper for us to have taken care of them on the front end than on the back end? And I think that's what we're trying to say. Let's do things on the front end and not do so many things on the back end.